I'm Elizabeth Berner. I'm interim director of the KL2 program, and I am actually a KL2 alum as well. I've participated in this program back in 2013 to 2016, and I think it works, and that's why I've agreed to lead it on an interim basis. And I'm here to talk with you today about the KL2 program and let you know why we've established it, how it runs, and the opportunities that are available to people who are successfully accepted into the program. I think part of this is understanding what the context of translational research is. And this is a program funded through the National Center for Advancing Translational Sciences, which is one of the newer centers at the NIH. And the focus is really to bring scientific findings to the bedside faster. You know, there were some studies looking at how long it took basic science findings to become part of standard clinical practice. And the median on that was 17 years, right, from initial discovery to actual implementation in clinical practice. And that's frankly just too long. And so the center was established to think through the best processes for conducting research, how to innovate faster, and how to translate basic science findings into improved human health on a faster timeline. It's based in hubs throughout the United States. So we have one here at the MCD-CTS, which is for USC and for CHLA. And all of these hubs have similar programs. We are tasked with improving the infrastructure to provide translational scientists the tools they need to conduct their science and innovate faster, and also to provide training to the workforce that would be the translational scientists. So what we're talking about today is a specific part of our training programs, which is the Mentored Career Development Training Program for Clinical Translational Science, which is also called the KL2 program. It is one of the many training and education opportunities available, and you can also check out our other opportunities through the website. But the KL2 program is really about training clinical translational scientists and training people to be the leaders of these teams. And clinical translational scientists are a little bit different than other scientists. One is that, like all scientists, focused on generating innovative scientific knowledge. But specifically, we're looking at medical devices, medical interventions, things that accelerate the improvements in human health. So clinical translational scientists are focused on specific aspects of human health as the targets of their research. The other feature of clinical translational scientists is that they work in teams, right? Clinical translational scientists are trying to cross barriers to move from bedside to clinical practice. And this requires working in teams of scientists, people with different training and different background that come together to really innovate and accelerate these improvements. And so clinical translational scientists must be able to integrate many different disciplines and types of research to generate that innovation. And we can think about that as being in different arenas of translational research, from preclinical and patient-oriented to population-based research. This is usually presented as the clinical translational science paradigm, where we think about these bench findings, right? Can we invent new solutions? And then do those solutions even work in humans? We take them to the bedside in those first human trials. But then we need to think about larger trials, right? Efficacy and effectiveness trials, where we want to understand, does that new intervention actually benefit patients? And then we move into ideas of more implementation science, where can we deliver that reliably in general clinical practice? And ultimately, we want to know, does this improve public health? And so all different scientific methods are part of clinical translational science, but they might be part of different parts of this translational science paradigm. And this is kind of the traditional thinking T1 through T4 or bench to public health philosophy of clinical translational science. But if we take this a step further, we really need to understand that those aren't really a continuum. We don't move from one to the next. When we're really trying to innovate and improve human health, some of our preclinical work, right, might be important to jumping to the next step. But sometimes in clinical implementation work, we find ways that we really need to change how we're studying the preclinical side. So it's not a linear set of series of studies. Sometimes it's back and forth, it's in circles. We jump way ahead on the loop, but we go back. And you really have to be a quick thinker and innovative and be focused on the overall human health when you're designing your studies and understanding how you're fitting in with your teammates who might have different research expertise. And the other focus of clinical translational research that's really is critical is that patients are at the center. Right? And so any type of clinical translational research needs to involve patients in the setting of research priorities, in research design, in understanding implementation, because you can't improve human health if you don't have patients engaged in what the interventions are going to be. And so this is a much more complex paradigm, right, or a model of it, but they're both the simpler and the more complex model are important for understanding clinical translational research and how your research fits into the work of other people. So I think if you take a moment and think, where does your research fit in? Are you doing preclinical work? Are you crossing boundaries between preclinical and clinical research? Are you really understanding public health outcomes and potentially ways that clinical research needs to be redesigned to help meet those? Or thinking about how the implementation of interventions needs to be changed? And a clinical translational researcher is really thinking about these boundaries and how to cross over them. And so in the Mentor Career Development Program, we really focus on the skills that are needed for clinical translational scientists to be effective. And this is another paradigm set by NCATS of the skills that translational scientists need to successfully innovate and improve human health. And these include things that aren't maybe part of what you traditionally think of as research training. We are obviously focused on rigorous research and making sure that everybody has the skills they need to design, conduct, and analyze studies with the highest level of rigor. But to be a translational researcher, you have to be a systems thinker and think about how your work impacts the other research that's out there and the current system that patients are living in. You have to be a skilled communicator to discuss your work with other scientists who might not have your exact research or clinical expertise. Right? We talked about boundary crossing and moving between those different areas and how to be, design your studies to help make those jumps from one area to the next. And all of these team player, process innovator, domain experts are things that we focus on throughout the coursework and support that the Mentor Career Development Scholars receive. And this really, this design that we've been conducting and innovating on has been integrated into the NCATS goals update, which is really to train and cultivate the translational science workforce by making sure that patients or communities are engaged in all steps of the process. Really have to promote the integration of special and underserved populations in translational research, which is specifically an area that our hub is, excels in, is making sure that we bring in all people into our studies, that we aren't exclusive, and that we represent the nation's population in our studies. We also think about innovating the processes to increase the quality and the efficiency of translational research, especially in multi-site trials. How do we improve the rigor of these studies and make sure that you're designing studies that will be meaningful and have valuable work? And advancing the use of cutting-edge informatics and thinking about how to use existing data in, learning healthcare systems and other large data sets to understand how potential interventions and innovations are improving human health. So the Mentor Career Development Clinical Translational Science Training Program is really focused on supporting clinical translational researchers who are committed to an independent investigator pathway in achieving those skills that they need to become clinical translational scientists who are leaders in their field. There's a lot of us on the team. So Dr. Tamara Simon is our Workforce Development Director. I am the interim KL2 Director, along with Stephen Siegel, who's the co-director, multi-PI, and the Mentoring Resource Center Director, and Dr. Ricky Blusenthal, who leads us on Scholar Diversity and is our KL2 co-investigator. We also have quite a few faculty members who are involved in other aspects of the training, so that everybody in the program is getting their needs met, because we're all coming from different backgrounds, and we want to make sure that everybody has the tools and the skills to become an independent investigator. And our administrative and support staff who make sure that the program runs smoothly. And Jeannie, who's on with us today, is really the point person on all things KL2 and make sure that this program runs smoothly, and along with me, is the point person to ask questions about the application or the program. We do provide consultations upon request regarding your KL2 preparation. We can advise you about things like protected time, the budget, and the components of the application. And we're happy to meet with you to discuss those. What we can't do is tell you that's a great research strategy, right? We can't advise you on that because, that's for you to develop with your mentorship team. But we can let you know the types of things that are looked for and are favorably looked at in the application process. Because through this process, we're really hoping to train and nurture individuals who are committed to a career in clinical and translational research, right? So what we're really looking for are people who this will be the focus of their career. And we want to provide multidisciplinary and team-based clinical translational research education and mentoring training to you as you mentor juniors, and to your mentors as they mentor you. So the program started back in 2011 here at SC with our first cohort, and annually since then, that's me right there, we've added 4 to 5 scholars a year to our program who've successfully gone through all the education and training and support that are part of it. And we are now up to 65 active alumni or current cohort members. Our group is very representative of the faculty here at USC. We do try to emphasize providing support to those who might not receive the informal level of mentorship and support in classic department structures. And it's not just the School of Medicine and CHLA. We have people, faculty from occupational science, physical therapy, pharmacy, social work, bioengineering, who are part of the program. This is about training clinical translational scientists, not just physician scholars. There is a predominance of MDs in the program, but we do have people with research PhDs, combined degrees, or other professional degrees who have been successful applicants. What's important is that really 99+% meet the NIH K-type requirements, so early career investigators who are on a research pathway. So that's the first thing. You don't have to be a health professional, but you do have to be on a career path in clinical and translational research. You have to have your doctoral degree, whether it's a PhD or a professional degree. You must be junior faculty or anticipating promotion to faculty status. So senior fellows or senior residents who will be faculty by the time the program starts. You need to be a US citizen, a non-citizen national or permanent resident to apply, and that is per NIH regulations and guidelines. And you must be able to commit 75% effort to the program, which means your research and research training. And you need to show that you have a strong and committed mentoring team. Lastly, you have to have strong support from your department. So your division or department chair needs to write a letter stating the type of support that's provided to you on your pathway to being an independent investigator. What we expect from you by participating in the program is that you will pursue a mentored research project in your area of expertise that has a clinical and translational focus. You will complete a master or certificate in clinical translational research, which was up until last year known as the Masters in Clinical, Biomedical, and Translational Investigations. You'll complete additional coursework and other co-curricular activities that are specific to the program, such as the Career Development Seminar Series, the Digital Scholarship Program, the Research Ethics Forum, or the Work in Progress sessions. You'll attend the Translational Science meeting in the first year that you participate in the program, where we travel together with all the first year cohort and the KL2 leadership to attend sessions specific to your career development and how to apply translational science concepts to your work. And by completion of the program, you will apply for an individual NIH award, either either further training award or an independent R award. And the program works. Of our 48 alumni and 13 currently active in the cohort, 98% are active in clinical translational research currently. They haven't fallen off that pathway. Together, we've published over 1,500 papers and received over $110 million in grant funding, mostly from NIH and other government contracts, and 72% as the PI or multi-PI role in these awards. So this program is really about developing our promising junior investigators to be rising stars in clinical translational research. I mentioned that there's some expectations of how you will participate, and a lot of it has to do with your training. That clinical translational research certificate or master's is focused on a core course that people take in their first year. It's a year long, 3 semesters. I teach that along with Dr. Patino Sutton, who was a longtime KL2 director of the program here. And the course is really focused on developing your foundational clinical translational science skills and applying it to your work in progress. So not to theoretical projects that don't exist yet, but to your research that's going on now or that you're actively planning. The Career Development Seminar Series are monthly webinars that are focused on developing those clinical and translational skills that we talked about earlier. Digital Scholar is also a webinar series that's once a month. Research Ethics Forum is every month or 2, also webinar based. Our Work in Progress is an in-person session. So every 6 months, all of the cohorts that are active, the 3, and their mentors get together to present their works in progress and the progress they're making on their research and also on their career development plans. And it's an opportunity to get feedback from other mentors, right? People that don't know and love you specifically, but are experienced in mentoring and can provide some guidance or some suggestions on the next steps that you might take. And that translational science meeting, which is required of all first year cohorts. To help make that feasible, there is financial support that is provided as part of the program. The MCD-CTS provides 2 years of funding, and the department's, your scholars department is expected to provide that 3rd year. You get 75% effort, up to $90,000 plus fringe for that 3 years. You're expected to participate. Additionally, for the scholar specifically, there is up to $25,000 a year for tuition for further coursework and training, for travel related to research with some restrictions below, and then actual, financial support for your research as available to you in that budget of $25,000 a year. Just note in that first year, there is a limit of $2,500 towards the translational science meeting, but then another $2,500 to attend any other conference that might be relevant to your work. In year 2, it's just the $2,500 for travel for a conference that's specific to your work. The mentors are a critical part of your application and your success in the program. They need to be involved during the application process in helping to review all the components of the grant application you're preparing and in writing you letters of support. But really what we need is for them to show that they are willing to participate in all the mentor training aspects of the program. They need to make sure that you have the protected time that you've been promised in your application process and meet with you regularly to evaluate your progress. But also they need to work with the workforce development leadership to make sure that the mentoring strategies being applied in your relationship with them are working for you. They need to attend your work in progress sessions and give feedback to you and the other scholars. And then there are additional mentoring workshops, several hours throughout the year to increase their skills and mentoring and providing guidance to you as you move through the program. The application just opened on June 1st. You can go to our SCCTSI website to Education and Training and download the application guideline. There's a lot of components to that application. We'll go through them in a moment, but make sure that you have all the documents prepared so that you can, when you log in, upload the required documents to the correct area. We do not use the KL2 system that other grant applications use at the school. This is a separate internal application process where you need to make sure that you're uploading the documents to the correct sections. So this is the website where you can get more information, get the application guide, and we'll send these slides out so that Casey can send them to everybody. But the first component is the letter of intent, and we ask that you submit a letter of intent by August 2nd if you're planning to apply. This makes sure that we have the correct contact information for you, gives us a rough overview of what you hope to achieve in the program, what your mentoring and educational goals are, and then your research title and a brief summary of your proposed research, along with your mentors and co-mentors and names and email addresses of 3 potential reviewers. The reason that we ask for this is to make sure that we have expert reviewers in your area when you do submit your application. And that is uploaded via the online application system. The full application is not due until August 31st, and that includes basic demographic and other information required by the NIH. If you're resubmitting from a prior year, there's a space to upload a response to a reviewer's comments. There's also the area for your mentor section, which includes your mentor's bio sketch and also a letter of recommendation from your mentors and your department chair stating their support for you in the program. There is a proposed mentoring plan, which really includes your career development goals and how your mentors will support that, your research project timeline with deliverables, and then your plans for extramural funding, manuscript preparation, and meeting presentations. That's separate than your education plan, which is really about the didactics and activities that you plan to take to meet those, those career goals that you have. And then it comes to the proposed research plan. And one thing we hear a lot is that it's so short, but it's supposed to be short because this is your outline of your plan that you're going to undertake as a scholar. And it's likely going to change some. As we take you through training and thinking through your science, you're going to make some changes. But it follows really the standard NIH format of what's expected, a personal statement, a structured abstract, specific aims, your strategy, any preliminary data or literature cited, a bio sketch. We also provide an area to upload your CV, as many applicants might be very early in their academic career and not have, a fully developed bio sketch yet, but we still want an opportunity for you to show your professional success so far. And then lastly, those suggested reviewers who need to be people who might be experts but don't have a conflict of interest with your work. The last parts are really administrative things, your annual salary information, which is important for the NIH reporting and preparing the budgets for those that are selected, and then a signature page from your mentor and your department chair confirming that they support your application. Once those applications are submitted at the end of August, from September to November, we go through a review process. The applications are reviewed by external review committee, which includes reviewers from your area of expertise, but also an internal review committee composed of the KL2 leadership and other faculty members, which really focuses on the mentoring and education plan and the likelihood of success based on the support and the education plan you're showing. The applicants with the highest likelihood for funding are invited for face-to-face interviews with the internal review team. And those interviews are for applicants and mentors from early to mid-November, and you both must attend that session or that interview. We are reviewing based on your track record and your mentor's track record of mentoring, your education plan, your mentoring plan, also your research strategy, and then the resources shown in your application. You know, is your home department and your mentor showing commitment to your development? And do you have the clinical and laboratory infrastructure needed for your research? There needs to be strong support for your required protected time. That needs to be crystal clear in your application that you will have the time to commit to this intense education and mentoring program. And then your research career potential, right? Are you on that jumping board about to take off on your career? If you are accepted, award notifications are sent out in early December with program orientation before the winter break for you, for your mentors, and then also for your department chair or administrator so that they understand the administrative and financial components of the program before you start it. And the start date for this year would be April 1st, would be when this year's KL2 cohorts would start. But we have other important dates here on the slides of, when your letter of intent is due. Application submissions are August 31st, no extensions, and then the rest of the review process and our timelines on that. And we'll make sure you have these slides for review later.